information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to another episode of Bermuda Health-Abets. This is a podcast where we discuss everything from A to Z on healthy living with the mission of empowering, informing, and motivating Bermuda's residents. I'm your host today, and my name is Marie Beach. I'm the Healthy Schools Coordinator for the Department of Health. I work very closely with the Department of Education, other government departments, and most community health partners that have programs and activities in schools. I've actually worked for the Department of Health for 20 years now. So today I want to welcome our guest, Crystal Baxter. She's an environmental health officer with the Department of Health, and one of her passions is for educating and working with the public concerning issues related to their safety, hygiene, and health. Good morning, Crystal.
Good morning, Ms. Beach, and good morning to your listeners.
Beautiful. Thank you so much for joining us. So our topic today is keeping your environment safe, the role of the environmental health officer. So I'll let Crystal tell us a bit about herself.
Good morning once again. I'm so happy to be here. My name is Crystal Baxter, as we said, and I am a environmental health officer with the Department of Health. I've been with the department for close to 15 years now. I'm a registered sanitarian and a registered environmental health specialist. So I've worked across the island in different areas, and I currently work in the city of Hamilton on the eastern side. It's a small area, but it packs a punch.
Wow.
Yes.
Thank
So
you.
I really enjoy it. So
Lovely. Yeah. And I actually remember when you first started. And listener, she's a lovely young lady. And I've had the privilege of working with her periodically through the years. And she's definitely a very knowledgeable individual as well. So can you tell us what it takes to become an environmental health officer?
So I'm going to direct this first to our high school students who may have an interest in science or just like to investigate or to solve problems. So at a minimum, anyone interested in becoming an environmental health officer should look to go and get a bachelor's degree in environmental health. So from there, you can receive additional training and certification with a professional body. So that's like NEHA or Chartered Environmental Health, right? After that, if you've already completed some of your training, let's say you have a general degree in science, you can get a master's degree in environmental health as well.
Lovely. Thank you. So having said that, what made you become interested in becoming an environmental health officer?
So I've actually been interested for a long time, even before I came. So I've worked in government actually for a number of years before this, and I worked in departments that sort of shared interest with the things that environmental health does, and I think that sparked my interest. So when the opportunity arose, I applied and joined the team.
Lovely.
Yes.
Thank you for that. So can you tell our listening audience what environmental health, the actual unit for environmental health, does?
So I'd love to. Our unit has a number of functions. It's so many. Where do I start? So environmental health is comprised of 4 units total. We have vector control. Many of your listeners may have heard our podcast from our supervisory foreman. He was recently on. We do have occupational safety and health, port health, and then our team, the general environmental health team. And we are responsible for running several national licensing and inspection programs. And the overall goal is to maintain and improve the health of Bermuda. Bermuda's people, and our focus is disease prevention in the community.
Wow, that's so interesting. So when I think of general environmental health, would that include barber shops, tattoo parlors? Can you expand?
Correct. So when we say what environmental health does, it is a broad list, right? So yes, it does include the barbershops, tattoo parlors, hairdressers, cosmetologists. We also run a food and beverage safety program, which involves inspecting all of the restaurants island-wide, including food trucks, grocery stores, food warehouses, you name it, we're there. If they sell food, we're inspecting it.
Wow, and you just jogged my memory. Many years ago, I worked with the environmental health team and nutrition services at the Department of Health, and we developed a contract for food service providers.
Okay, yeah.
And that contract included aspects of the Public Health Act, how to convey
Yes.
food safely from
one
point A,
yes, that's it.
meaning maintaining the correct temperature.
Yes.
Cold food should be at a set, what is it, 40?
Held below 40 degrees
degrees
Fahrenheit.
Fahrenheit.
Yes.
And
And
hot
hot food
foods.
should be above 140 degrees Fahrenheit.
See, and
yes.
I learned all of that from my colleagues at
Yes.
Environmental Health.
Excellent.
But yeah, it is very vast. And I'm even thinking when I was building my house, didn't I have to have an inspection?
Correct. So we are involved in the process when you renovate or you build a new house and you're installing new plumbing. So our inspectors come and do plumbing inspections. So we make sure that the sewage is going through the correct place, that, you've got all the elements that are there and in accordance with the Bermuda Building Code.
So important. And I do recall knowing that the planning officer worked in tandem with
Yes.
environmental health.
That's correct, yes.
Very important.
So environmental health also have a desk at planning, and we review all of the building and permits that come through for environmental health matters.
Wow.
Yeah.
Now, I didn't know that part. So I learned something new
New-
every
yes.
time. Thank you, Crystal. So I'm thinking of even vector control. Can you expand a bit on what the community could expect from environmental health?
Right. So environmental health also work in tandem with our vector control unit. So if we are notified of an issue developing in relation to rodents or mosquitoes, we can work in tandem with them just to go investigate, find out what's the cause, we provide advice, but it could be elevated if we find that a person is doing something that can harbor rodents or cause the mosquitoes to breed. So we do give advice to the public in those issues.
And I do know that you work with many other units across government in general. I do know many things I've learned from your team and really have been kind of given permission to do in the schools as the Healthy Schools Coordinator, and making sure that I touch base with environmental health to make sure what I'm telling the schools is accurate. Any advice, if I'm unsure, I call environmental health. Is this still the case?
Yes.
But I realize that it isn't just within Department of Health that you work with.
Yes.
Are there other government departments?
So there are.
You said planning.
Yes. So as we mentioned, there's a Department of Planning. We get involved in reviewing all of those new plans. We do work with DENR in a number of cases.
Can you define what DENR is?
That is the Department of Environment and Natural Resources. So we do get involved with them, sort of coordinate some efforts sometimes. We work with Works in Engineering, waste control. If we have issues, we reach out to them and would say, oh, there's a buildup, accumulation of waste in this public area. Can you assist us? Can you help us? And they are all often ready to help, I have to shout out to Venice Gordon. She's provided some excellent assistance to us through the years. So.
Excellent.
Yes.
And I have to say, even during the pandemic, I had to reach out to the EH team, environmental health team, numerous times. Absolutely numerous times.
Yes.
The learning curve was exceedingly steep for all of us.
Yes.
And I'm forever grateful to how generous you and your team members were in
Thank you.
assisting me with what I had to do. And I'm thinking back to some of the things that I do with Environmental Health's blessing is to ensure that schools are opening their windows
Correct.
for optimal air
And
circulation.
ventilation. Yes.
And as well as, I was going to say something. Oh, the water
The
testing.
water testing, yes.
Yes.
So we encourage and we do provide a service at the office. We do have bottles for homeowners to come in, get a set of bottles. You collect your water sample and bring it in from Monday to Wednesday. You want to bring it in shortly after collection. And what we'll do is coordinate with the central government lab and have your water tested. And then once the results are in, the environmental health officer will give you a call and discuss those results with you. So if you have an issue with the tank, we'll tell you how to treat it, if it needs cleaning, and all of those sorts of things.
Excellent.
Yeah.
And one little plug I'll put in here. I now have a sensor in my under-house tank.
Excellent. Yep.
And it's a program.
Yes.
You pay this annual fee. And so I no longer have to take the top
Take that
off
heavy
and
top
see how
off.
much water I
Yes,
have.
yes.
The sensor tells us how much water we have, how much water we've used every day, how much water we gained
Yes,
during each rainfall. But the lovely part of it is it also has a reminder for getting our tank clean.
Oh, wow. Yes. So according to the legislation, everyone is supposed to clean their tanks no more than every 6 years. So in that 6 years, you can build up accumulation sludge in the bottom. And I think at times we get busy, we forget, we've all got that pristine tank water, but we've got
Yes.
to remember to take care of it. It's our source, let's clean our tanks.
So would you say that the sludge at the bottom of our tanks, could that make us sick?
It has the potential to do that. It's holding various things that have washed off. We've got an open system. Everything's washing off from
So
the
birds
roof. Yes. You've even caught a cat up there walking. So it is a good thing to either treat the water, if you can, chlorinate the water, and have that tank cleaned regularly.
Wow.
Yeah, the catchment should also be cleaned every two years.
Wow.
Yeah.
Okay, thank you for the reminders.
Yes.
I'm a homeowner, and I've got to put those years in my
Yes.
calendar. Thank you.
All right.
So, what do you like most working at Environmental Health?
Right. So I think that this is the crux of it, is giving advice. So we get contacted all the time by members of the public. They have this issue. How can you help me? So that's a big part of my job, and that's the part I think I like the most, because the advice given is in so many areas, and sometimes we have to research. You call. I may not know it all, but I will look it up. I will get back to you.
Wow.
Yeah.
Wow. So I'm just thinking back to something you said earlier when we were talking about general environmental health tasks and inspections. And you mentioned restaurants. So what would a restaurant inspection entail? Because a lot of people eat out. My mother
Yes.
seems to have a little tender stomach.
Yes.
And any little thing can really upset her
Upset,
if it
yes.
not done properly.
Correct. Yes, yes. So the environmental health office, that's a big part of the work that we do as a team, is carrying out annual pop-in inspections and evaluations of restaurants across the island. We do have upwards of 600 plus restaurants across the island, and those are the main high-risk restaurants. We have even more home bakeries and all of that. So even home bakeries, the environmental health office inspects. So when we go into a restaurant, it's an intense exercise, right? So we go in, we're checking the fridge, the freezers, all of the temperatures. We're reviewing the workers as they work, just to see what they know. We may have a chat with them to make sure they understand the process.
Washing hands.
That's
and
it. That's
head,
it.
Head, a net.
Having proper head covering,
Yes.
the hair is pulled back, the wearing of jewelry, nails. We want to look at that and say, what are you doing? You need to make sure your fingernails are trimmed, your nails are clean. We look at the restaurant itself. Is it clean? Has someone put in a cleaning schedule, and is it being maintained? Because we don't want to eat in anything, unsightly. We check the bathrooms to make sure the facilities are okay for the public. And then we look at the food. We look at the food. Is it in date? Are they cooking it properly? Are they storing it properly? So it's a lot of things that we do look at. We look at out the back. Is the garbage being taken away at regular intervals?
Wow.
So, yeah.
And so from all of that, a restaurant would get a grade?
Correct. So since 2017, I want to say, restaurants in Bermuda have been getting what's called a grade on license. So that informs the customer how is the restaurant doing based on our last visit, right? So when we went, we looked at all those items we discussed, and we give it a score out of 100. So if you score between 90 and 100, you've got an A. You've got an A, and that A is for the year. It is for the year. If you score between sort of 80 and 89, you've got a B, and C is 70, 79, and so on. So D is the lowest score that we do issue.
Do you ever close a restaurant?
So if you're scoring below a C, and we found critical items, any item that is, imminent risk to health, or we need you to fix it immediately, 24, 48, or 72 hours, we may ask for voluntary closure. And if there's sort of heavy issues, yes, we do.
But it wouldn't be your first
It's
decision.
not the first thing, but we are here to protect the public. So we will if we need to use that.
Yes, and
Yes.
just as a gentle reminder to our listeners, all of Department of Health functions under the Public Health Act 1949.
Correct.
We all have to follow that.
That's it.
So the public is welcome to access the Public Health Act 1949 on Bermuda Laws online, and just anyone's free to not so much challenge us, but question.
Correct, yes.
Anything that we say. And if you're confused about it, all of the officers are bound by that law.
Those laws and the regulations
and
underneath.
the regulations.
Yes.
So, every now and then there's an amendment or something happens, and generally the public is a part of the amendment process. So, just to throw that in there.
Yes.
So, just talking about the restaurant grades, is there a way that the public can find out a restaurant's grade before they actually go to eat there?
Right. So on the government website, we post annually the grades of all the restaurants that we've inspected. So if you're not big into the internet and stuff, it's actually quite easy to find. If you bring up www.gov.bm, and in the search bar, just type grades on license, and it'll take you to a list of those updated grades, and you can look at the restaurant that you intend to visit.
Thank you. And I'm just thinking, like, I don't eat out that often, but every now and then I might pop into some establishment and grab something. What can a member of the public do if they see insects?
Yes.
While they're waiting for their meal?
Right. So one of the things that we can't be everywhere, right? And so sometimes, and we really appreciate it, the public is our ears, our eyes, right? So we can get tips from the public. I visited this place and I saw, and we will go and investigate based on that. Because we want to be proactive. We want to make sure that the public is safe. So, if you've experienced something at any premises, you can give us a call.
That's great. And if someone happens to have suspected food poisoning, or they ended up at the hospital and was told they had food, what do they do?
Right. So hopefully that does not happen.
Yes.
Right. So there's a system in place that allows us to sort of get that information. So if you do feel unwell as a member of the public and you believe you got food poisoning, contact your doctor first. If it is very serious, do not hesitate to seek medical attention. The system in place, your doctor actually communicates with the Ministry of Health. And so through our epidemiology department, the environmental health department gets what are called referrals. and they give us all the details. It's given in a way that just allows us to investigate. It's not all of the unnecessary things that we don't need to know, but just those things that we need to know to carry out an investigation at a food business.
Excellent. So as we wrap up, is there anything in particular that you would like the public to know about environmental health in general, or something specific?
Right. So I just want to let the public know where we're located. We are located down in Devonshire on Hermitage Road. You can, like I said, we enjoy getting information from the public. You are our eyes and ears at times. Do not hesitate to give us a call if you need advice on your water, your tank, and you can reach us at 278-5333.
Excellent. And I just want to thank Crystal Baxter, Environmental Health Officer with the Department of Health, for coming today to share all of this very interesting and useful information. I learned something.
Thank you.
And I think we just all need to be aware that environmental health's remit or reach is far, it's vast. It isn't just that they do port health, they do occupational safety and health, and whatever they do, it's across all of the age groups. So they're concerned with schools all the way up to the nursing homes in some shape or form. Everyone is touched by environmental health. Would you say that, Chris?
I would say that's correct. That's correct.
Okay.
Yes.
So thank you, listening audience, and you're free to share any feedback with us on the Department of Health Bermuda YouTube page. And I want you to keep an eye on this spot for the next episode of Bermuda Health-Abets. So thank you again, and today's topic, just a gentle reminder, was keeping your environment safe, the role of the environmental health officer. Thank you, Crystal.
Thank you.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.